Today's lecture is on electronic health records. Here is a brief history of electronic medical records. The electronic health records are a solution to medical mistakes. Communication problems causing medical errors include lost or misfiled paper records, mishandled patient messages, inaccurate or unreadable information, mislabeled or unreadable laboratory or prescription orders. And this is what brought about the use of electronic health records. An electronic medical record, an EMR, is health-related information for an individual, providers or staff located in a single healthcare organization. An electronic health record are shared by more than one healthcare organization meeting high-tech standards, and the federal government's ultimate goal is that every medical record is electronic. Your personal health record is a medical history and a lifelong record maintained by you, the individual. Meaningful use and the EHR. Goals of meaningful use for the EHR are improvement of quality, safety, and efficiency, engagement of patients and family, improvement of care coordination and population public health, the maintenance of privacy and security of patient data. That's what meaningful use is for the EHR. Advantages and disadvantages of EHR programs. Advantages are fewer lost medical records, eliminated reduced transcription costs, increased readability or legibility of charts, chart access, availability for multiple users at multiple times, increased access of patient education materials, decreased duplication of test orders, efficient transfer of records and billing data, and decreased storage needs. Disadvantages: cost, staff training, need for IT support, required upgrades to existing system, and available programs wrong fit for practice needs. In other words, is the program that you're looking at not the right fit for your need? Is it missing a lot of information that you might need? Working with an electronic health record. General guidelines for using an EHR program include becoming familiar with the hardware and the software, and respecting patient privacy and security. In other words, don't read a patient's record if you're not taking care of the patient. Creating a new patient record using EHR software. Use a basic template with required fields, and patient demographics are on the face page or the first page. Correcting an electronic health record is called adding addendums. Other functions of EHR programs. The EHR has multiple functionality of practice management systems, such as specialty specific with customized templates. So if you're in general practice, that's one type of template. If you're in OBGYN, you have a special template or form on the electronic health record. If you're cardiologist, you have specific forms or templates. We call them windows of your needs for patient care. Electronic schedulers, eligibility, verification, and referral management. These are all necessary in a practice. Billing and coding software is an integral part of a practice management system. When the doctor touches on chest pain times 4 days, behind it are the codes to send off to the insurance company for payments. Report generators. We can report many different types of, we can generate many different types of reports needed for the office and for public health service. Electronic prescriptions. These started out in about the 1990s, where you were no longer handed a piece of paper. The doctor will send that over right away. Ancillary order integration. The doctor orders a hip x-ray for you. It goes immediately to the x-ray department, and you don't have to carry any paperwork. And patient access. We can look into our patient records. Security and confidentiality and the EHR. Reassuring others about electronic health record confidentiality and security. No office policies for security and privacy. And it is that each person has their own sign-on and login, and they're only given access to the part of the patient record that they need to have access to for taking care of the patient. For instance, if you are documenting vital signs, you have no access to the patient's financial information because you don't need to do that. Be positive about new technology. Create a pamphlet regarding Office EHR. Demonstrate patient portal for access to the EHR with your patients. Explain Office access audit trail pertaining to release of information. So the patient says, I need to have, or the doctor says, we're going to send you information to Dr. Smith for your broken shoulder. Then you can watch the audit trail and see that your doctor sent Dr. Smith the x-ray, which is already there because they're on the same system. But your doctor's write-up about your visit is automatically available to Dr. Smith, especially if they're in the same practice. For instance, New Haven, Partners Healthcare. If you are in that network, then you can see where the patient's been at other doctors' offices and facilities for care right on your desktop. And that ends today's lecture on electronic health records.